Okay. All right, so muscle, we'll start with the muscles here. Okay, so this first one that says make sure you know structure and function. Okay, so another way of saying anatomy and physiology is structure and function. So the anatomy is the structure, the physiology is the function. Okay, so they're the same thing, structure and function. So that's what the class is on everything. And in fact, in the future, when you start doing clinicals, you'll be able to help your patients better if you understand the structure and the function. Okay, so that's just the underlying concept with pretty much everything that comes with healthcare and clinicals and dealing with humans and patient care and non-operative procedures, operative procedures, ICU stuff to general care and practice. Just understanding the structure and how it works will help you be a better clinician. Okay, so this is the starting point for that is A&P 1. So in your notes or your readings, anytime you come across the word the function of, it's a test question. Okay, so if you're doing your note cards, you would write down on the front side of your note card the function of, and then on the back, then answer the question. Okay, so that means this one bullet, it covers a multitude of things. Okay, so the testing format is what you're used to, multiple choice, multiple, and then some true false. Okay, and that's for the lecture part. Lab is different. Lab is simply identify. Okay, you see a picture of something, and then just what is it? Okay, so know the different types of muscle in your body and what the PowerPoint slides have to say about them. Okay, so we talked about a lot of different muscles, obviously, and so there's two parts to this one. Okay, the different types of muscle. You have skeletal muscle, cardiac muscle, and smooth muscle. Okay, skeletal, cardiac, and smooth muscle. So that's part one. Like, what are those? That's the structure, and then the function. What is the function of those three different types of muscles? Like, where do you find them? What do they do? Okay, know the diagram on the different coverings of the muscle. Okay, so in the notes, there's like a cross section of a muscle, and it has the epimysium, which is the outside most. Then you have your fascicles, and the fascicles are wrapped by the perimysium. Okay, and the innermost, you have your muscle fiber, and the muscle fiber is wrapped by the endomysium. Okay, so that diagram. So know the diagram, the different coverings of the muscle. Okay, any clinical condition that we went over in class, most of those were oral, meaning I just talked about them. And also there are some research articles that I covered. And when I ask test questions on research articles and the clinical examples that I give, I do try to write them in such a way that hopefully you can answer it just through common sense or deductive reasoning. Okay, try not to make those extremely complicated. For example, a question might say, if a person, it'd be a true or false question as an example here. If a person has poor ergonomics, would they be susceptible to back pain, neck pain, headaches, muscle aches, that kind of thing? Okay. So yes, we talked about it. Yes, there's a bunch of articles on it, but it's also written in such a way where you're like, well, yeah, if a person has poor ergonomics, it can cause back pain and neck pain and all that. Okay. So we also talked a lot about stress and sympathetics, and those are some other, I gave some examples, and then we talked about how sympathetics can create adverse health, okay, because you're in stress all the time. And so if I talk about some real life examples, I try to write it in such a way where you should be able to get it, okay? Like an example would be, of the following, what would most likely occur in a person who is constantly in sympathetics? Okay, well, first of all, you'd have to know what that means to be in sympathetics. Okay, and that's fight or flight. And then you look at your choices, and it might say they sleep very well at night, they have a well-balanced diet with no gastrointestinal dysfunction, they have high blood pressure and trouble falling asleep. Okay, so based off the choices, you're like, well, high blood pressure and trouble falling asleep is the most consistent choices that has to do with sympathetics, right? Because that's your stress or fight or flight. Being stressed out all the time also lowers your immune system. Okay, so it's immune suppressant. And, there's a lot of other adverse health things that we talked about here and there throughout the quarter. Okay, so same with the research articles. Like one of the research articles we talked about was core stability. And these researchers tested hundreds and thousands of people over the course of time. And these people had chronic low back pain. And they did MRIs and CT scans and all these cool electrical analysis of the muscles and all that. And they found that if you have a weak core, weak multifidi muscles, weak spinal stabilizer muscles, they are infiltrated with fatty tissue and they're weak, and it increases your chance of low back pain by like 400% or something like that. Okay, so I would ask questions that would allude to that. All right, so I think you get the idea, and that would apply for everything that we've talked about clinically and through the research. Okay, so I do try to ask those in a more pretty straightforward way where you should be able to get it. All right, now this next one gets into more raw memorization. Okay, know the parts of a muscle. Okay, what's a sarcomere? Now, if you're using this test review, then ideally you'll want to have your book or your notes or the internet available so you can look this stuff up, because just looking at the page here, you may not know what a sarcomere is. That's okay, just look it up. Now, we did talk about it, but if you forgot or whatever, that's okay. That's the point of studying and reviewing is, you know what? I don't know what a sarcomere is. Let me look it up. So it doesn't matter the source, whether it's your book, the notes, or the internet, they're all going to tell you the same thing on what a sarcomere is. Okay, and then, by the way, that is the structure. Okay, the sarcomere. What is the function? Okay, so what does a sarcomere do? Well, on a muscle fiber, right, a sarcomere is broken down into a bunch of sections, and if I remember correctly, I described them as stacking up Coke cans, right? So if you take a 12-ounce Coke can and you stack them up, you get one long line. Okay, so if you look at it from a distance, it just looks like one long line. But when you zoom in closely, they're actually individual segments, right? And that's a sarcomere. And then within the sarcomere, you have the contractile unit, the actin, and the myosin. So if you're making note cards, you would put sarcomere on the front of the note card, and on the back, talk about it. And then each individual thing that you come across, like actin and myosin, which is part of the sarcomere, you would put that on a separate note card. Okay, the sarcoplasmic reticulum, that I usually abbreviate as the SR in the notes, all right, that stores calcium. Calcium is part of many ingredients to help with muscle contraction. Okay, the actin is the thin, the myosin is the thick filaments. Collectively, these are your myofilaments. So let's say you're reviewing this and you came across actin and you're like, you know what? I don't know. It's okay. Look it up. And when you do, you'll see that it's the thin filament. It's a contractile unit of the muscle. Myosin and the myosin heads actually bind to actin. And that's what helps with muscle contraction. Okay, the T tubules are responsible for neurological signaling and continuation, and they're embedded within the muscle fiber, and they talk to the sarcoplasmic reticulum, and it's part of what's responsible for releasing the calcium. Okay, and what is the Z-line? Okay, and that is within the sarcomere. There's boundaries within the sarcomere. And this would be tough to know what a Z-line is just by looking at this, meaning reading it off of this notes. You'd have to look at a picture. Okay, a picture paints 1,000 words. Okay, and then what is troponin and tropomyosin? Okay, those are components built within the actin to help with myosin head binding. Okay, now just as a test review disclaimer, I'm just gonna go through the gist of this stuff, okay, to set you in motion. All right, this bullet that says no physiology and diagram of the axon terminal, pre and post synaptic, and all that stuff that we covered. Okay, that is just that one bullet is a lot of things. Okay, so we had the nerve that came in, and at the end of the nerve was the axon terminal, or the end of the nerve, and it embedded itself within tissue. And then you had the space, right, the synaptic cleft. What is a pre and what is a postsynaptic membrane, right? So the pre is on one side, the post is on the other. Okay, now there was more things that came with it, such as the vesicles that are within the axon terminal. I described the vesicles as a balloon. And inside the balloon, there's a bunch of confetti. And when the balloon pops, it's going to release the confetti. The confetti actually represents the neurotransmitter. And the neurotransmitter we focused on was acetylcholine. And acetylcholine will cross the synaptic cleft, hit the postsynaptic membrane, and hit receptors, which will tell the tissue what to do. So if it's a muscle, it will help tell the muscle to contract. Okay, know the action potential slides, diagrams with each part of the graph. We went over and what's happening to sodium and potassium. Okay, there was also a video on that. All right, so this one had to do with a cell at rest and a cell in motion. So at rest, there was a higher concentration of potassium on the inside and a higher concentration of sodium on the outside. Okay, and when an electrical signal starts to take place, then potassium leaves, sodium enters. And so now we're in motion, right? So now there's more sodium on the inside and more potassium on the outside. Okay, so the videos I have posted for that are really good. They're these 3D animations that really help break it down. So a picture paints 1,000 words and a video paints like 10,000 words. So that'd be a good one to review as well. Okay, the sliding filament theory. Okay, well, first of all, what's a filament? All right, the filaments are the myofilaments, and that's the actin and myosin. And what happens when actin and myosin contract? They do slide and glide over each other, and they pull each other toward the middle, right? So that goes back to your sarcomere. And I have a video of that posted as well that shows you how the actin and myosin bind and how the myosin heads pull to get the to get the muscle to shorten. Okay, so this one, know the difference between aerobic and anaerobic and the different ways we can get ATP. Okay, so you'd have to go to the notes and look at, well, first of all, what does aerobic mean? Okay, and then what does anaerobic mean? So aerobic is with oxygen and anaerobic is without oxygen. And the bottom line is how many ATP are produced during the different energy phases, right? So your oxidative phosphorylation, aerobic, anaerobic pathways, and all that. Okay, that was in the notes. The bottom line is we, as humans, we need energy. Okay, we need ATP. And then where is ATP even made? It's in the mitochondria, right? So your main ingredients are oxygen, must be dumped into the mitochondria. Now there's other ingredients as well, like coenzyme Q10. Now that gets into some biochemistry that we didn't cover, but there's some other ingredients that your body needs in order to make ATP. okay? Now, if you all take a biochemistry class, that's the time when you really dive in and it's really fancy on all the different ingredients that goes into creating ATP. But here's the thing, no oxygen, no more ATP, and then the tissue dies. Okay. And later on, when you learn about heart attacks and strokes and things like that, you'll come across terms like ischemia, lack of oxygen, hypoxia, decreased oxygen, and what happens to tissue. Okay. Now that's for clinical cases, for meaning abnormalities and pathologies and stuff like that. Now in real life, just for basic everyday function like daily activities or exercise like lifting weights or running, which means aerobic and anaerobic stuff, you need ATP. And then if you're not in shape, for example, if let's say you've never run before, okay, fine. Well, let's go run today. All right. Well, your first mile or two is going to absolutely suck and you're just going to hate it because you're not used to it. The oxygen supply and demand isn't there. You don't have enough mitochondria. You don't have enough of the red blood cells and oxygen carrying capacity. That's why it hurt. But guess what? Your body will adapt. And you'll produce more ATP and you'll learn. And then, you know, that first day, that mile was absolutely brutal. But if you stick with it, eventually that mile is nothing. It was easy. And now you got to go 2 miles. And then eventually that'll be easy. And then you got to go 3 miles and so on. Okay. So that's what that discussion was about, is how our bodies make and produce ATP and how many ATP do you yield in the different energy phases. Okay, be able to define origin, insertion, antagonistic, a synergistic fixator, what a pinnate, parallel, converged, divergent muscle is. Okay, some of these will just have to like get a visual. Okay, look up what a like a pinnate muscle is. Okay, these are basically, those are the shapes of the muscle, and the shape of the muscle is going to help dictate the movement and how powerful or not powerful the muscle is. Like, look at the muscle in your eye, for example. It's a muscle, but it can really only move the eye. Compare that to your quadricep muscle, right? The muscle in your thigh. That's a very strong muscle. Okay, I don't think your eye muscles can squat, 200 pounds, right? Your leg muscles are going to do that. So in other words, the size of the muscle, the shape of the muscle, and the way that they're shaped will dictate how strong they are, how powerful or not strong they are. Like, an eye muscle, really, if you kind of think about it, it's really not that strong compared to a quad, right? The little muscles in your hands that are for my fine motor skills, like removing stitches or doing calligraphy or, writing, versus your calf muscle, which is the gastrocnemius, which is a gross motor skill. It's designed to run and jump, and it's a power muscle. Okay, so that's what the shapes of these muscles helps determine. Okay, now if you don't know origin and insertion, then you're going to have a hard time being able to figure out what the muscle is through its origin and insertion. Okay, origin is the more fixed point, and insertion is the more movable point of a muscle. Okay, so there's some visualizing that goes with that, right? You have to, it's raw memorization, but it's also visualizing. Meaning when you look at a muscle, like you look at the bicep brachii, okay, if you contract the bicep brachii, what part is doing the most moving? That is the insertion. Okay, so with all the muscles, as you're visualizing the muscle itself, the name of it, where it's located, the bones it's connected to. Also try to visualize how, when you contract it, what is doing the most moving. Okay, so that's both raw memorization and visualizing and concept. Okay, antagonistic is the muscles work against each other. So your bicep brachii and your tricep would be examples. So the tricep would be antagonistic to the bicep. Because so what happens if you fire both muscles at the same time? There's no movement. So when you're moving your bicep brachii, the tricep to some degree has to relax. Okay. So it's because they're antagonistic. Now, synergistic muscles means the muscles move together, like with each other. So, an example would be if you grab a weight in your hand, okay, let's say a 20-pound dumbbell, and you lift it to do a bicep curl. Here's the question: is only your bicep brachii contracting and no other muscles are contracting? Well, of course, the answer is no. Other muscles are contracting as well to assist in the bicep brachii moving that 20-pound dumbbell, your so-called bicep curl. Those would be synergistic muscles. Okay, so there's other muscles working with the bicep brachii to help you actually do the movement. Okay, that would be synergistic. A fixator is also known as a stabilizer muscle. So your fixator muscles will help to stabilize the area. So your core is a good example. Your rectus abdominis, transverse abdominis, the internal, external oblique, which are part of your abs, right? If you engage them, they are now fixed or stabilizing, and now you can go do whatever movement or activity or sport that you need to do. Okay, and that's true all over the body, right? There's, if a person has a shoulder surgery or a shoulder separation and we need to rehab it, well, we're going to work on all of those fixator or stabilizing muscles that help stabilize the shoulder to get it strong again. Okay, so that's simply what that means is, like stabilizing fixator. Okay. Now this one, the rest of these, and sarcastically put, now the fun part, and that is gross anatomy of muscle. This one, because it's raw memorization, there's really not a lot of concept behind it, not much understanding behind it other than just memorize the heck out of it. It's kind of like if there's 500 people in the room and you have to remember everybody's name. Wow. All right. Well, let's just dive in. Memorize over and over and over again. And eventually you're like, okay, now I know all, 500 people in this room. I know their names. There's really no rhyme or reason or concept to that. It's just memorize it. Okay, that's kind of like the muscles. Where's the pectoralis major? Where's the rectus femoris? Where's the anterior tibialis? Okay, the latissimus dorsi, right? The sternocleidomastoid. So this one bullet covers many things, right? Because we went over a lot of muscles. Okay. So this is just exposure over and over and over again to the muscles. Now I gave you a list. I gave everyone a list of the muscles that we covered, and you've got the 3D app, you've got the internet, you've got your book, and if you really don't know where the flexor carpi ulnaris muscle is, just look it up. You can type it in on the internet or in that 3D app. There's a way to type in the muscle to get it to pull up right away. Or in your book, you know, you could kind of go old school and look at the index, and it'll tell you the page number where those muscles are found. Okay, now what I did back in the day, now this is just me because it works for me, is I would actually draw my own interpretation of the muscle. Okay, it doesn't have to be perfect. You're not trying to win an art competition, but I would draw, what looked like the carpal bones in the hand and the radius and ulna and all that, and probably did that in regular graphite pencil, and then with a colored pencil, which would be red because it's a muscle, would draw what the muscle looked like. Okay, and I would do that for all the muscles. Okay, now today, you have the advantage of that 3D app, so you can pull up the muscle and spin it and look at it from all different angles and stuff, zoom in. Okay, you can take a screenshot of it, so there's your electronic note card, and or draw your own interpretation. So granted, that's a lot of work. You know, there's just no way around that. Lots and lots of memorizing, lots of muscles. The videos I have on the muscles, you know, they're posted, so you have access to them 24/7. So watching the videos one time and writing things down isn't enough. Okay, you have to do it many, many, many times. And then that way it starts to burn into your mind as memory. Remember the 3 to 5 synaptic loops. Okay, then you will likely store it as memory, meaning you've got to be exposed to information 3 to 5 times. So you look at it, you read it, you write it down, you look at it again, whatever, and then chances are it'll be stored as memory. So in other words, just going over it once isn't enough. Okay, and that's true for anything. You know, even your phone number, if you get a new phone number and you only say it to yourself once, you probably won't remember it. But if you say it to yourself 3 to 5 times, it will probably stick as memory, and now you got it with your new cell phone number. Okay, so the practice quizzes, the practice tests. Okay, so for example, of the following muscles, what muscles would you find in the hand? Okay, there's different ways to ask about muscles in a written version. Okay, so when you're doing the lecture test, it's all written. There's no pictures. Okay, and then when you do the lab test, that's all visual, lots of pictures. So of the following muscles, what muscles would you find in the hand? Okay, bicep femoris. Well, you'd have to know where that is. Okay, and if you do, that's in the leg, right? It's on the posterior side of your femur. Your so-called hamstring is your bicep femoris. Well, that's clearly not in the hand. So then what you do is you cross it off, and don't second guess yourself. Like, well, wait a minute. Maybe the hand is in the leg. So I'm going to answer that one. Yep, done. No, don't second guess yourself. Okay, extensor carpi. Well, there's a clue. Carpi, that's in the wrist / hand area, or lumbricals. Okay, now this one I can see confusing people because you might have selected extensor carpi. Now that is technically the wrist, and the wrist and the hand are 2 different things. So the lumbricals are actually within the hand, and they are in between the metacarpals. So that would be the correct choice. Here's another one that might get you. Okay, in layman's terms, the arm is the entire arm, right? That's, if you go up to anybody and say, can you point out your arm to me? They'll probably trace from their shoulder all the way down to their wrist. That's the arm. But technically, the arm is the area of the humerus, and the forearm is the area of the radius and ulna. So if the question said, of the following muscles, what muscles would you find in the arm? Oh boy, what you gonna do? Pick muscles that are located mostly around the humerus, or pick muscles mostly located around the radius and ulna. Because if you're not careful, in your mind, well, the arm is the entire thing. Nope. It's the humerus part, that's the arm. The radius and ulna area, that's the forearm. Okay, so you gotta be really careful on your clues within the question. Okay. Okay, you can also ask questions based off of origin and insertion. All right, so like for example, what muscle would have its origin on the ribs in the xiphoid process? Okay, or what muscles would have its origin on the pubic symphysis? Or what muscles would have its insertion on the transverse process? Okay, and so on. So let's take another one. Okay, the size of the muscle. So what of the following muscles, what would be the largest muscle found in the posterior pelvic region? Gluteus maximus, gluteus minimus, gluteus medius, or piriformis, gluteus maximus. Well, you'd have to be able to visualize, like, what is a big muscle? Like, what's the biggest of these muscles that were presented to me? Well, if you're comparing the piriformis to the gluteus maximus would win, because that is the bigger of the two muscles. And that's provided the question said, of the following muscles, what is the largest muscle? Okay, some muscle questions are after their shape, right? So, it may say, of the following muscles, what muscle was named after a geometric shape? Bicep brachii, extensor carpi, or deltoid? Well, the answer would be deltoid, right? Named after a geometric shape. So your trapezius, your rhomboids, your deltoids, right? There's just some things named after their shape. Okay, and this one right here, this bullet that says stick with what we've covered. Okay, so sometimes, and believe me, it's easy to do, you can go down these rabbit trails because you're studying the muscles of the hand, and then all of a sudden you're starting to watch surgeries on the hand because it's cool, and you did that for like 3 hours, and we covered none of that stuff of surgical procedures with the hand. And then you come and it's like, I studied for 3 hours. It's like, yeah, watching surgery videos, like we didn't even cover that stuff. So I'm not going to test you on it. So that's trying to be mindful of the quality of your study time. Stick with what we've talked about. Okay, and believe me, that's common. I get that a lot, where students come and they, to me, and and not just to me, I mean, they do this with other instructors, and like, I studied for 47 hours, and it's like, yeah, but over stuff we didn't cover. Okay, so just be careful of that. All right, know your eye muscles and the cranial nerve formula. Okay, now when you come across all these bullets, like, don't just let it come to your mind, actually write it down. Okay, so the eye muscles, there are 12 total, 6 on one eye, 6 on the other. what are they? Okay, not only write them down, but actually pull up a picture of the eye and look at them, right? The muscles of the eye. And our formula, LR6SO4R3, what does that even mean? Okay, lateral rectus, innervated by cranial nerve 6, superior oblique, innervated by cranial 4, and all the rest of the eye muscles innervated by cranial nerve 3. So if there are 6 eye muscles total, and this formula already gave you 2 of them, that means there's 4 eye muscles that you need to know. And you would write down the other 4 eye muscles. So that would be inferior rectus, inferior oblique, medial rectus, what am I missing? Nope, I didn't mean to do that.
I have superior rectus, inferior medial, and inferior oblique.
Or I did not mean to hit that where everything, okay. So let's do that again. Okay, LR6SO4R3. All right, inferior oblique, medial rectus. And what'd you say?
Superior rectus, and inferior rectus.
So that's what it means by all the rest of the eye muscles are innervated by cranial nerve 3. Okay, well, I'll take it a step further. Cranial nerve 3 has an AKA. Oculomotor. All right. Now, if you didn't know, based off of our formula there, LR6SO4R3, to then also know the AKA for cranial nerve 3, that's okay. It would have come back to you once you get into the nervous system review, because it'll tell you, know your cranial nerves, the Roman numeral, and its alternative name, okay, the full name. Okay, also look up Myasthenia Gravis and Parkinson's disease, determine how they affect the muscles. All right, now let's just say you don't know what Myasthenia Gravis is or Parkinson's is. That's okay. You just look it up, right? What did we say about it, or what does the book say about it, or online say about it? Now, also keep in mind that this is ANP1, not advanced neuropathology class stuff. So if you look up Myasthenia Gravis and you find yourself 2 hours in researching it, way too much. Okay, it's just quick version. What is it? What is Parkinson's disease? Okay, these happen to be neurological complications, right? So Parkinson's is basal ganglia lesion, right? So you would write down everything we said about it and or what the notes say. Okay, so basal ganglia has to do with acetylcholine and dopamine. Dopamine starts to fade in a person with Parkinson's. So acetylcholine and dopamine ratios are off, and proper ratios of acetylcholine and dopamine allow for more coordinated muscle contraction. And because the ratios are off, that's why they start getting tremors. And myasthenia gravis has to do with weakness and fatigue of muscles, because the communication between the nerves and the muscles are being damaged. It usually starts with, classically, it starts with vision problems. Okay, like double vision, your eyes don't move very well. Okay, your speech is off. You notice you have trouble chewing food or gum or whatever. It's just different. You're like, man, I feel like I can't even with coordination, like chew food anymore. Like, what's going on? Okay, it could spread to the arms and legs. It can be misinterpreted for multiple sclerosis. So usually people go in, they get checked, because sometimes some of these things mimic each other. Like, how do you know it's not Parkinson's or MS or myasthenia gravis? Well, you may not. So that's why you go in, and testing and stuff like that, then we can figure it out. So here's the nerve. Okay, and here's the tissue. And normally you have a neurotransmitter that goes across. Well, there's a block there that prevents the neurotransmitters from communicating to tissue. So that's myasthenia gravis. Okay. Any questions so far with muscle stuff? All right, let's do nervous system. Okay, so structure and function of the nervous system, again, and I mean this literally, with everything, always try to understand the structure and its function. Even down the road, when you get to clinicals and you're looking at a machine, here's the machine, that's the structure. What does this machine do? Right? Let's just have fun with it. A defib machine. All right, you're looking at it. This is a defib machine. Well, what does it do? Well, they're going to teach you what it does. Or an AED, the automatic, like they have pretty cool ones these days where the computer does all the readings for you, and it will advise you to shock the person. If the computer determines that, and in fact, I think the brand new ones, you don't even have to push the button anymore. You just hook them up to the AED, and the computer, I think, says, reading or scanning, something like that, some sort of computer voice, scanning, shock advised, and it just does it for you, right? So things are pretty cool these days with technology where you know, the advancements, it's just, you know, cars that drive themselves, and that's definitely something that's going to be here before you know it. Anyway, there's the structure. What does it do in the human body? You've got all these structures. What does it do? Even in with equipment, here's the structure. What does it do? So just like that concept never goes away. Okay, so I try to give you clues of these things within the notes by putting things in bold, italic. Okay, sometimes I'll even say highlight this, know this, okay, stuff like that. Like those are things you should certainly make note cards of. All right, here's a good start. What is the function of the nervous system? Well, it's the master controlling system, you know, the brain and the spinal cord and all of its nerves communicate afferently and efferently to keep you in homeostasis. Right, and there's about 37 million terabytes of stuff that happens per second because of that. It's so advanced. Okay, I made that number up, but it's a lot, right? So if you really think about what the brain and your nervous system is functioning every second of every day, I mean, it's a lot. All your internal functions, your heart rate, blood pressure, immune system, digestion, hormone release, pupil dilation, blood vessels dilating or constricting based on your temperature and other things that are going on. What kind of mood are you in? You know, are you hungry? Are you tired? Are you alert? You know, arousal stuff, whatever. Annoyed. You know, these are all. Plus, you're listening to me and writing things down and reading things like that. It's and the motor coordination it takes just to grab a pencil and write stuff down and think about it, like that's a lot, right? So if you really think about it, the brain, your nervous system and all that, the master controlling and communicating system, brain to body, body to brain. Okay, what is afferent? What is efferent? Afferent is body to brain. And here's some other things that's kind of fun about this. Afferent, body to brain. It's also sensory. Okay, efferent is brain to body, and that's motor. Okay, how many pairs of cranial nerves? Okay, we have 12 pair. And how many paraspinal nerves? Actually, anybody know how many paraspinal nerves we have?
Can you repeat that, please?
How many pair of spinal nerves do we have?
Isn't it 24 because we have 12 and 12?
Well, that's cranial nerves.
Oh, okay.
31.
How many pair of spinal nerves? Good, 31 pair. Okay, now if you didn't know that, that's okay. It's in the notes, or you could just look it up online. And yes, that is a little deceiving, right? Because you'd have to know the difference between cranial nerves and spinal nerves. And even in the spinal nerves, you might be thinking, well, there's 24 vertebrae, so maybe there's 24 pair of spinal nerves, right? So it can throw you off, right? So that's that would be, well, for me, it would be a note card thing. At the time when we covered it, while physically in class, and this is just my style back in the day, I would take notes either on the PowerPoint or on just a sheet of paper. Then I would go home later and then make my note cards. Okay, I didn't really do the note card thing during class. I didn't feel like that was the right time because, you know, the instructor is just throwing tons of information at you and I wanted my note cards to be clean and crisp and accurate and laid out nice and pretty with good handwriting and stuff like that. But class time, you're just taking notes like crazy, and you're hoping, man, I hope I can read my own handwriting later, because there's so much stuff being thrown at you. Okay, so then later I would make my note cards. Now here's the other thing about that. I wouldn't wait, because what happens is week 1, tons of material, did not do your note cards. Week 2, more material, didn't do your note cards. All of a sudden it's week 4 and you're like, crap, I've got a lot of catching up to do. So I wouldn't do that. So I would make sure I stayed on top of it, because I knew that I didn't want to have so many things to do in a short period of time. So I divided it up. So week 1, I just knocked out that material and now it's done. Week 2 and so on. So now by the time the test was around the corner, all my stuff was done. My note cards were done. Everything was done. All I had to do was review them. Okay, so it saves time. So you don't have to cram it in the end. Okay, and then again, true for all your classes. Like, don't wait till the end, because then it's an information overload. All right. Sympathetic versus parasympathetic. Okay, sympathetic is fight or flight. Parasympathetic is rest and digest. In the neurotransmitters, right? So the sympathetics release acetylcholine from the pre-ganglionic neuron, and the post releases epinephrine, norepinephrine from the post-ganglionic neuron. And then your parasympathetics is acetylcholine and acetylcholine from the pre and the post. Okay, and that's how the tissue knows to be in fight or flight mode, is based on the neurotransmitter that binds to it. Okay, so epinephrine, norepinephrine will put your body in sympathetics. Okay, now the body is going to respond differently depending on the tissue we look at. For example, your digestive system shuts down during sympathetics. So when epinephrine, norepinephrine bind to your digestive system just knows to decrease in its function. However, when epinephrine, norepinephrine goes to skeletal muscle and your heart and your lungs, everything opens up. More blood gets rushed to the muscles and to the heart and to the lungs and bronchial dilation and all that stuff. Why? Because your body is preparing for fight or flight. So it takes the blood, moves it away from the digestive system, and sends more blood to your skeletal muscles and all that. Okay, parasympathetics is rest and digest, so you're calm, more relaxed, healthy digestion, heart rate is normal, breathing is normal, everything's just more relaxed during parasympathetics, and acetylcholine is what helps to be responsible for that. Okay, motor versus sensory. Okay, now that one got quite complicated, especially when we were doing our cross sections of the spinal cord, right? So sensory is body to brain, and then motor is brain to body. Okay. Later we'll talk about I'll review that cross section of the cord with you, and then we'll come back and visit some of that motor stuff and sensory stuff. Okay, voluntary versus involuntary. Okay, your voluntary nervous system is skeletal muscle you choose to move around. Anybody know or remember the AKA for the involuntary nervous system? Okay, it was somatic. So voluntary or somatic. And then that one is right here. So there's your voluntary versus involuntary, somatic versus visceral. Now, if you were doing your note cards and you did not know that they were correlated, you probably would have figured that out with your writings. Okay, so for example, on your voluntary, you write that on the front of the note card, and on the back side, you would have defined it. Okay, what does that mean? And because you're reading your notes, you would have come across, oh, it's also known as somatic. Aha, now the light bulb's starting to get brighter. And then you would make an additional note card on somatic. And then you would start to realize there is going to be some overlap, right? Some connections there. So involuntary, also known as visceral, okay, involuntary nervous system is also known as autonomic, which means you do not have conscious control over what's going on. Like when you eat food, you're not sitting there consciously making all of the digestive enzymes and the cells and all that stuff, like break your food down and move it through the peristaltic wave through all the tubes in your stomach area. Like you don't have conscious control over that. Your involuntary nervous system is doing it for you. Okay, so this is anatomy, right? An axon terminal. The node of Ranvier, a dendrite, astrocyte, a synapse. Okay, so just define them on your note card. Write down synapse on the back side. What is it? What is an astrocyte? Okay, that was part of the glia, the neuroglia, right? We had, I think, 5 different ones: the astrocytes, oligodendrocytes, microglial cells, ependymal cells. And that's all right here. So on these, so define, know, understand, just all these things, okay? And I would just look them up, okay? Because when you get a visual with what goes with it, it usually sticks better, right? Okay, so let's do some of them. I don't want to really do verbatim just because they're definitions and relatively easy to look up. But so the dendrite, that is on a nerve cell. There's the cell body, right? And you have these like branch-like things coming in, right? And a dendrite brings incoming information into the cell body. I'm gonna just randomly pick some ones here. So gray matter versus white matter. Okay, that was on our cross section of the cord. The butterfly shaped or H-shaped structure in the middle was the gray matter. Gray matter. And everything else was the white matter. White matter because it is made of myelin, and myelin is a fatty type substance, so it just has a whitish appearance. Gray because there's a bunch of cell bodies, so it gives a gray appearance. All right, Pacinian. Naked nerve endings, Pacinian, Meissner's, Golgi tendon organ, muscle spindle. Like, what are these things? Right. Well, these are part of your. They help with some sensory. So, like naked nerve endings are pain. You recruit and activate a naked nerve ending, you're going to experience pain. Right. Pacinian is deep pressure. Meissner's is a light pressure, and in the picture it showed a person holding a paintbrush, right? And the bristles on a paintbrush are pretty soft, right? And when you touch those, you know, it's like a soft touch or a light touch. You're going to activate more of the Meissner corpuscles. Okay, the Golgi tendon organ and muscle spindle, those are going to be like balance feedback, right? So your Golgi tendon organ and muscle spindle help with balance feedback. The fancy name for that is mechanoreception, proprioception. And then there was a video posted of the proprioceptors. Okay, what makes up the brainstem? Right, so there's 3 different parts to the brainstem. What are the 3 different parts to the brainstem? Anyone? Anyone? The midbrain, pons, and medulla oblongata. Okay, now that you know that, then remember structure and function, right? So what is the structure of the brainstem? And then what does it do? Okay, what is the pons? What does it do? What's the medulla? Okay, what are the functions of the different lobes of the brain? Okay, so in this review here, it doesn't look like it gives you actually the names of the lobes. That means you'd have to look it up. So can anybody give me an example of a lobe?
Frontal.
Good. How about another one?
Occipital. Temporal.
Good. Okay, so on the front of the note card, frontal lobe. On the back, what does it do? Because there's your structure, right? The frontal lobe, that's the structure. Then on the back of the note card, you're going to talk about it, which essentially would be the function. And if you want, you could even draw a picture of it. So you could draw your own version of the brain and then kind of highlight the area and say, well, there's the frontal lobe. Okay, the frontal lobe is thinking, reasoning, comprehension, language, stuff like that. Okay, so write down your, because the review question to some degree is generic, meaning what are the functions of the different lobes of the brain? Okay, well, when you actually start to write them down and then talk about their function, you realize, wow, this is actually very detailed. Okay, what's the function of the cerebellum? Okay, now cerebrum and cerebellum are easily confused. I do see that mix up, if you will, on exams, just because they have a similar spelling and a similar sound. Okay, the cerebellum, so going back to our little cartoon brain here, the cerebellum is like located there. Like the posterior inferior aspect of the brain, and it is responsible for balance and equilibrium. And then on the notes and videos and stuff that we talked about, the tests for cerebellum dysfunction. So diadokinesia, and if they can't do it, it's dysdiadokinesia, rapid alternating hand movements. You take the heel of your foot, click it 3 times on your knee, glide your heel down your shin, see if you can do it. Finger to nose, walk the straight line, you know, like sobriety test stuff. Those are cerebellar exams. Okay, so when you're seeing this one bullet on the function of the cerebellum, you realize there's many things that come with it. So draw it out, talk about it. What are the tests? What does it do? Okay, and same with your pons and medulla, cerebrospinal fluid, cerebrum. Okay, what are the meninges? Okay, well, for starters, there's 3 of them. The dura mater, arachnoid mater, and pia mater. Okay, where is cerebrospinal fluid found? Anybody know where the cerebrospinal fluid is found? Okay, in the subarachnoid space. Where does the cerebrospinal fluid come from? Where does the cerebrospinal fluid come from? Good, choroid plexus. Okay, the circulation pattern of the cerebrospinal fluid travels throughout the ventricles in the brain and travels down the spinal cord, down to the sacrum area, and comes back up and circulates throughout the brain. Okay, you have about 150 milliliters of it, and because of the notes, you could keep writing. Like you can do a spinal tap to figure out what, if a person is sick and you suspect the cerebrospinal fluid or the meninges or whatever are hurt, then you can do a spinal tap to withdraw the fluid, the CSF, to have it analyzed and see what's going on. Okay, also know that when you withdraw cerebrospinal fluid from a person, they risk having headaches. So ideally, you want to be resting, recumbent, laying down for 8 to 12 hours. And it takes about that long for your body to replace what was lost. Okay, where does the spinal cord begin and where does it end? Okay, so around the foramen magnum C1 is where the spinal cord begins, and it goes all the way down to L1, L2. That's where it ends, and it ends at the conus medullaris. Okay, what is the continuation of the spinal cord past L1, L2? I'll give you the English version of it. Horse's tail. So what's the Latin of that? Cauda equina. So cauda or caudal is tail or going toward the tail, and equine is horse. Right, so the cauda equina is the continuation of the spinal cord. Okay, function of the posterior horn and of the anterior horn. Okay, on your spinal cord, here's the anterior aspect, posterior aspect. All right, there's the posterior horn, anterior horn. Okay, this would be sensory and motor function. Okay, Broca's versus Wernicke's. Our fun, would this be an acronym? Okay, BMWs. That stands for Broca, motor, Wernicke, sensory. Speech. Okay. Broca, motor, so that'd be motor speech. Wernicke is sensory speech. So know the difference. Okay, tracks versus cell bodies versus gray matter versus white matter in the cord. Okay, so we drew cross section of the cord. Right, you've got the gray matter, and then everything else is the white matter. All right, the tracks. So remember, divide the cord in half. The dorsal columns were back here, dorsal columns. The dorsal columns were made up of the fasciculus gracilis and fasciculus cuneatus. And that would be a tract, that a highway system that goes from, that travels up and down the spinal cord to get to the brain. Those are tracts, things that, it's like a highway system. Okay, a cell body are different synapses that take place on the spinal cord itself, right? So those are cell bodies. Okay, the gray matter was the butterfly-shaped thing in the middle. And the white matter was everything else because it's myelinated. Okay, we cover different pathologies of the brain. So you'd have to look in your notes to answer those. I think one of them was hydrocephalus. And then I think we covered stroke, transient ischemic attack. Okay, maybe traumatic brain injury was in there, which is in the concussion family of things. Okay, on the spinal cord, where is the sensory nerve root found and the motor nerve root found? Okay, so don't confuse the nerve root versus the anterior and posterior horn. Okay, I've seen that done as confusion. Of course, on my end, it's hard to tell if they just didn't know or if they were confused by it, right? So cross section of the cord. Posterior aspect, anterior aspect, right? The nerve root the nerve root on the posterior aspect is responsible for sensory. Okay, so that would be sensory in. And then the anterior is motor out or efferent. All right, spinal reflex versus a reflex. Okay, one of the biggest things is a monosynaptic versus multisynaptic. A spinal reflex involves the spinal cord itself. It's weird to say, but the brain is not involved. The brain is aware of what's going on, but the reflex is actually operated and carried out by the spinal cord. And what that does ultimately is it saves time, so it's very fast. So if the information goes in through the cord and back, that's quick versus information to the cord up to the brain and then back to the site. Okay, and then a reflex itself, there's different ones, right? So for example, there's a reflex for hunger. Okay, you're hungry and you smell food, you see food, right? That's the sensory part. Now the reflex to that is you start to salivate, your gastric juices start to flow, and there's just this desire to eat. Okay, how do you test for a reflex in a patient? Well, one of the ones we talked about was the reflex hammer. Okay, you strike the patellar tendon, your choices: patellar tendon, Achilles tendon, bicep brachii tendon, tricep tendon. Okay, you can also test for pupil reflex with a pen light. Okay, what is the function of the cerebrum? Okay, the cerebrum is the biggest structure of the brain. Okay, you know the pre versus post central gyrus and the central sulcus and their function. That one's pretty fancy. And that one's certainly going to take a little extra work to dive in. Right, so in the brain, you had the central sulcus. And then you had, and I'm doing this in red because that represents motor, that is the pre-central gyrus. And then blue is sensory, so there's the post. Okay, so ideally, it's sensory in. Okay, your brain is going to integrate or think about the appropriate motor response, and then motor response. Okay, the areas of the brain are specific, called the homunculus. Okay, the homunculus was the spatial map over the primary sensory cortex and motor cortex, that post-central gyrus and pre-central gyrus, right? There was a map. And so that way, you know, if you know the map, then you know the area of the brain where the synapse is going to occur. Okay, what part of the spinal cord is responsible for pain? Okay. Cross section of the cord. If you divide your cord in half, so right and left, okay, always orient yourself, posterior, anterior aspect, and then we can also divide it, you know, the posterior and anterior. Okay, the anterolateral system, which is composed, or one of the main things is the spinothalamic tract, is responsible for that pain and temperature that goes to the brain. Okay, so what part of the spinal cord is responsible for pain? Anterolateral system, spinothalamic tract. Okay, keep in mind, pain and temperature decussates at the level of the cord. So let's say it's your left hand. Okay, information would go in. Since it's the hand, okay, and just for simplicity reasons, let's say it's your entire hand, so fine. So that would be C6, C7, C8. nerve root and all the peripheral nerves that go with it, because that's what innervates your hand. You know, if you smash your hand, the information is not going to go in at L1. That's not the level of the cord. Okay, so information goes in at the level of the cord because it's pain and temperature. It's going to cross over or decussate, hit the spinothalamic tract, which is part of the anterolateral system, and then go up to the thalamus, and then to the appropriate area of the cortex. Okay, and that goes back to your homunculus, the spatial map of the brain, what part of the brain interprets the hand, is responsible for the hand. Okay, it would be the same. I'll do this in red just to make it stand out. If you smash your right hand, fine, information comes in on the right side, the dorsal nerve root into the dorsal horn, crosses over at the level of the cord, the anterolateral system, spinothalamic tract, goes up to the thalamus, and then goes to the primary sensory cortex, the appropriate part of the brain. Okay, then there was the tactile information, so let's do that. So cross section of the cord, gray matter. Okay. When you're new to this, you want to orient yourself. So divide your cord in half, right side, left side, and divide it that way, posterior, anterior aspect. Okay, I'm going to do that again. Okay, now because the question is asking about tactile, okay, tactile travels on the dorsal columns, and those are broken down into the fasciculus gracilis and fasciculus cuneatus. All right, this is the posterior aspect of the cord, anterior aspect. So posterior is also known as dorsal. So that would be in this area. Okay, now I'm going to shade these just to make them stand out better. Okay, the fasciculus cuneatus or the lateral part of the tracts, and the fasciculus gracilis are in the more medial aspect, fasciculus gracilis. Okay, to some degree, oversimplifying this for sensory reasons. Let's do our little gingerbread man here. There's the belly button. Okay, so about the belly button down, all of that is the FG responsibility, and about the belly button up, is the fasciculus cuneatus. So in other words, if tactile information occurred at your hand or your arm, the information is going to travel in and synapse on the fasciculus cuneatus. If it was on your lower leg, tactile, then that information would travel in the fasciculus gracilis part of the spinal cord. All right, so I'm going to do this in red just to make it stand out better. Okay, so let's say it is your left hand, tactile, okay, non-pain, non-temperature. Information comes in. The dorsal nerve root, dorsal horn, synapses on the fasciculus cuneatus because it is your hand. So upper extremity stuff, fasciculus cuneatus. And it goes up ipsilateral because it's tactile. Tactile decussates in the brainstem, okay, the pyramids in the brainstem, then goes to the thalamus, then goes to the cortex. All right, pain and temperature decussates at the level of the cord, tactile decussates in the brainstem. And let's do in yellow, let's do a lower extremity. So let's say it's your right foot, okay, sensory and tactile. Sensory comes in the dorsal nerve root into the dorsal horn, goes over to the fasciculus gracilis because it's lower extremity, tactile, travels up ipsilateral to the brainstem, more specifically the pyramids within the brainstem, crosses over. Now we're on the opposite side, so that's your decussation. Goes to the thalamus, and then goes to the appropriate part of the sensory cortex. Okay, the function of the thalamus is to all incoming information must go to the thalamus, and the thalamus relays that to the cortex. Okay, function of the basal ganglia. Okay, that's your acetylcholine dopamine and helps with motor control. Damage to that causes Parkinson's. Okay, the anterior and posterior pituitary gland. So there's the anterior pituitary, posterior pituitary. Posterior pituitary releases ADH, antidiuretic hormone, and oxytocin. And then the anterior pituitary releases everything else. Follicle stimulating hormone, luteinizing hormone, growth hormone, thyroid stimulating hormone. Okay, the dermatome patterns, you'll have to watch the video that I posted on that. Okay, and we had the excuse me, the neural mapping of it as well. So it's the guy that kind of looks like a mummy, right? And I remember saying that it's like, here's our mummy guy, you know, all wrapped up. It's what it looks like, but those are your dermatome patterns. And knowing your dermatomes will help you understand, you know, why a person might have some sensory issues or whatever in those different dermatome patterns. Okay, so that one you'll have to watch the video and just go back to your notes. Okay, what level? So the sensory, our tests for sensory, right? Our neuro tests. Okay, you have Q-tip and pinwheel. Right, the Q-tip is for tactile. Does this feel the same as this? The pinwheel is for pain and the temperature pathways. And then you can run the Q-tip and pinwheel over those specific dermatome patterns. Okay, so if you want to assess their L4, so lumbar number 4, nerve root, that goes out and innervates a certain dermatome pattern in the body. Okay, so then you would mark, which would be in the lower leg area. Does this feel the same as this? Always compare both sides. Okay, what nerves make up the lumbar plexus? And that'd be L1 to L5. The cervical plexus, C1 to C5, sacral plexus. Okay, so your the sacral nerve roots, right? All the stuff that comes out of the sacral, so S1 to S5. And then you have the brachial plexus. Okay, that does not look like it's in here, so let's add it. Okay, and that one is actually the more complicated one that we did together. Okay, and that was C5 to T1. Okay, then on that handout, you would want to go over the nerve root like C6 and what is the peripheral nerve. Okay, that is associated with C6. Okay, part of that would be the musculocutaneous nerve, as an example. Okay, how about the C5 nerve root? And what is its peripheral nerve? That'd be the axillary nerve. And then what is the sensory area and what is the motor? Right, so the axillary nerve, if let's do our gingerbread man. Okay, that would be at the deltoid area. So muscle testing would be the deltoid, and sensory would be Q-tip and pinwheel over that deltoid area. Okay, that handout that we did maps all that out, and there was a bunch of them, so you'll want to make sure that you review that. Okay, and that's what all these are saying. Sensory from musculocutaneous nerve. Okay, where does the median, ulnar, and radial nerve go? Like, what does it innervate? What nerves make up the sciatic nerve? Okay, right here, know the different nerve roots and peripheral nerves for muscle testing and the sensory tests. Okay, so that covers quite a bit of material. All right, so that one, that handout is best, that had the pictures of the sensory areas and the muscle testing that we did. And some of them had deep tendon reflex. Okay, so that would be an additional neurological exam, the deep tendon reflex. And that was for bicep brachii, tricep, you strike the tendons, and the patellar tendon and the Achilles tendon. And always test bilateral. Okay, all right, now cranial nerves. Okay, that was quite a bit of information, and I do have a video of that posted as well. It's our lecture video together, so the notes that we took, and/or you could go back and watch the video itself to help you with that. So you'll want to know the cranial nerve Roman numeral name, such as cranial nerve 1, 2, and so on, all the way to 12. And then it's AKA or full name. Okay, so now I'm just doing some of them, right? You'd have to fill in the rest. Okay, and then what they function. So cranial nerve 1 functions smell, cranial nerve 2 is vision, cranial nerve 12 is swallowing and the tongue. So that's their function. Then how do you test for these things? And the same for cranial nerve 3 through 11. Okay, anybody have questions on any of this? Review stuff.
I do have a question, but it's not about this review stuff.
Okay, hold on one second.